Bleeding is a natural response of the body to injury. It occurs when blood vessels are damaged, allowing blood to flow out of the circulatory system. While minor bleeding is common and usually harmless, severe or uncontrolled bleeding can be life-threatening. Knowing how to respond to bleeding and understanding the necessary precautions can save lives and promote faster healing. There are 3 main types of bleeding, each with different characteristics. Arterial bleeding is when blood spurts with each heartbeat and appears bright red due to its oxygen-rich content. This type is the most serious and requires immediate medical attention. Venous bleeding is when blood flows steadily and is darker in color as it is oxygen depleted. While less dramatic than arterial bleeding, it still needs prompt care. Capillary bleeding is when blood oozes slowly from small cuts or abrasions. This is the least severe and often stops on its own. When dealing with bleeding, acting quickly is crucial. Here's what to do. Apply direct pressure using a clean cloth or sterile gauze to press firmly on the wound. This helps slow or stop the flow of blood. Elevate the wounded area if possible. Raise the injured area above the heart level to reduce blood flow. Apply a bandage. Once the bleeding has slowed or stopped, secure the wound with a sterile bandage to protect it from infection. Avoid disturbing clots. If a clot forms, do not remove it, as this can restart bleeding. Seek medical help if the bleeding is severe, arterial, or does not stop after applying pressure for 10 minutes. To prevent excessive bleeding, take care of cuts and wounds properly by cleaning minor wounds immediately with water and mild soap to reduce the risk of infection and keeping the wound covered with a clean bandage until it heals. Use safety equipment, wear gloves, helmets, and other protective gear during activities like sports, construction, or working with sharp tools. Handle sharp objects carefully. Use knives, scissors, and other sharp instruments with caution to prevent accidental cuts. Address bleeding disorders. If you have a condition like hemophilia, which impairs the blood's ability to clot, follow your doctor's recommendations and always carry necessary medication. Avoid blood thinners without medical advice. Medications like aspirin and certain supplements can thin the blood. Take them only as prescribed. Know your medical history. If you have conditions like anemia, liver disease, or vitamin deficiencies, work with your doctor to manage them effectively, as they can affect your body's response to bleeding. It's important to recognize when bleeding is serious and requires emergency care. Signs include blood that won't stop after applying pressure for 10 minutes, blood spurting from the wound, loss of a significant amount of blood, and pale, clammy skin, rapid heartbeat, or dizziness, which are signs of shock. Open wounds are vulnerable to infection, which can complicate healing. To prevent infections, clean the wound thoroughly, use antiseptic solutions as directed, change dressings regularly, and keep the wound dry. Watch for signs of infection such as redness, swelling, warmth, or pus. Some situations require medical attention even if the bleeding seems minor, such as deep wounds, especially those caused by sharp or dirty objects, bleeding from sensitive areas like the head, neck, chest, or abdomen, animal bites, as these carry a high risk of infection, and wounds that show signs of infection or won't heal after a few days. Bleeding is a part of the body's natural healing process, but it can become dangerous if not managed properly. Knowing how to handle bleeding, recognizing warning signs, and taking precautions to prevent injuries are essential for your safety. Be prepared, stay calm, and seek professional help when needed. With the right approach, you can protect yourself and others in emergencies.